Hello, my name is Kora Shamloo, and I'm going to be presenting my final project for HAP 671. So there are over 34 million Americans that have diabetes, and then there are another 88 million that have prediabetes. If it becomes uncontrolled, diabetes can damage your heart, blood vessels, eyes, and kidneys. And then 7.3 million Americans that are 18 years or older have diabetes but are undiagnosed. So the data that was used in the predictions came from simulated data from a major healthcare institution in the United States. There were about 829,000 unique patients, and there are around 17 million total records. So diabetes is defined using the Agency for Healthcare Research and Quality Clinical Classification System. And then there were 5,268 diagnoses that had at least 29 observations. Here are some examples that were obvious predictors. These are diagnoses that always occur with diabetes or have the word diabetes in their name, but were not used as the definition of diabetes. These include unspecified essential hypertension, pulmonary hypertension, and nicotine dependence. So after we calculate the likelihood ratios, we can put that in the naive Bayes formula to predict whether a patient has diabetes or not. Here, the data is split into two different data sets. 80% of the data went into the training set, and 20% of the data went to the validation set. The training data is used to learn patterns from the data, and the testing data set is used to understand how the model would perform in real-world scenarios. So here we calculate sensitivity and specificity. Sensitivity means true positive rate. This is to see if the code correctly identified patients with the disease. Specificity means true negative rate. This is to see if the code correctly identifies patients without the disease. The ROC curve plots true positive and false positive rate. So in summary, the predictive modeling tool is a good way to predict diabetes in patients, and it can also be used to predict other diseases such as cancer.